Good afternoon and welcome to our keynote presentation for Black History Month. My name is Shalini Hunter and I'm the Assistant Director for the Equal Employment Opportunity. And I'm joined today with Rihanna Gordon from the Office of Race and Equity and Charles Brown from Equitable Cities. A critical aspect of lifting up our department value of equity is to be deliberately inclusive. And one way to do that is really to celebrate our Heritage Months. February is Black History Month, and so today, in celebration of Black Americans, Caltrans is celebrating by hosting Charles Brown. Charles is a proclaimed street-level researcher working at the intersection of transportation, health, and equity. He serves as a senior researcher with Alan M. Voorhees Transportation Center and adjunct professor at the Edward J. Blaustein School of Planning and Public Policy, both at Rutgers University. Charles has 17 years of public and private sector experience in urban and regional planning, public policy, and research. And he also has extensive experience in community outreach and engagement, having worked with municipal, county, and state government agencies, for-profits, and nonprofit organizations across the U.S. and abroad. He's also the recipient of several notable honors in transportation. He's a military veteran and a recipient of the Mississippi Commendation Medal and Global War on Terrorism Service Medal. So today's conversation is very much at the center of a national dialogue within the planning community on issues that have to do with race, historical disenfranchisement, and marginalization. And there's a growing recognition both here at Caltrans and across the country for the need for a more inclusive lens. But to do that, we really have to shift from our white-centered paradigm and move into something broader, more equity-focused, and capable of mitigating inequities. Charles is here today to share with us his knowledge and expertise in this dialogue. And as we wrap up, both Rihanna and I may have some questions for him. So look forward to that. Thank you for joining us, and I'm going to turn it over to Charles.
Thank you. Thank you for that. Good afternoon, everyone. Again, my name is Charles T. Brown. It is indeed an honor to be here with you today. Happy Black History Month. As stated, I self-identify as a street-level researcher and a pracademic, given my more than 15 years of experience working inside and outside of academia. But to tell you a little more about myself, I was reared in a town of 500 people in rural Mississippi. That town is called Sugar Lock, Mississippi. But I have lived, worked, and played with and in communities all over North America. Some of those communities are blue, some are red, some are green, and many are confused. So in short, I'm here today to tell you, and I'll ask my colleagues to please mute themselves, that I have 99 problems, but understanding you isn't one. I also live according to the African proverb, I am because we are. With that being said, I would like to say again, thank you for joining us. Happy Black History Month. Thank you to Caltrans and all of your leadership for having me here today. But why focus on the topic of race and ethnicity in the work that we're doing? Well, I've chosen to prioritize the race conversation in my transportation equity work in order to broaden the narrative of transportation planning. See, I'm strongly committed to leading and centering race in all transportation decision-making processes because too often race is glazed over in planning, in research, in design, and in policy development. See, this unfortunately makes assumptions about the communities we are tasked to serve. And so what you instead get are proxies such as income, age, sex, gender, and access to a vehicle that are used as an alternative to avoid centering race-based issues. See, as planners, as engineers, etc., we have a professional and a moral obligation to acknowledge that the uneven development of our cities and the resulting racial health and wealth disparities are the result of systemic discrimination and racism, which is ingrained into all of our professions. Pick one. So what is equity? Equity involves trying to understand and give people what they need to enjoy full, healthy lives. Equity is also, most importantly, about the presence of justice and fairness within the procedures, the processes, and distribution of resources by institutions or systems. Like they always say, if you're looking for an inequity, follow the money. But more importantly, equity is not a desktop exercise. It's not some lens you put on to assess a situation. See, doing this equity work requires an understanding of the underlying or the root causes of inequality and oppression within our society. And there are various equity dimensions. It's not just race, it also includes ability, environmental, gender, generational, geographic, income, language, etc., 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 etc. So when you're talking about equity, it's important that you don't use a sort of generalized approach to it. Specificity is required in equity conversations. It also, because this work we do is so intersectional, we are so complex as a social being, it requires a consideration of social identities. And in order to get at these various social identities and how they may impact your work or the work that you do in the community, it's important that you ask yourself a series of questions, starting with which of your identities do you think about most often? Which of them do you think about least often? Which of your own identities would you like to learn more about? Which identities have the strongest effect on how you perceive yourself? And then lastly, which of your identities have the greatest effect on how others perceive you? So if you're being honest, you will say, it's my gender. Or perhaps you may say, it's my education status. Maybe it's your income. Maybe it's your race. The point is being, those identities that you think about least often are probably the identities that are absent from the tables when you're organizing meetings, when you're serving institutions and communities, and most importantly, when you're making decisions. See, I'm here to teach you about the unseen, not the seen. And in the case of the unseen, I'm going to share with you now an example that I use in my graduate classes at Rutgers University. I asked students a very pointed question. Looking at this photograph, which changes would you make? The context that I give them is this: the West Ward of Newark, New Jersey, a historically minority community. Given that context, which changes would you make? See, just like you, they are saying, I would fix the sidewalks. I would add bicycle lanes. I would add more greenery. I would add better pedestrian scale lighting, benches for people to sit. What about economic development, redevelopment, etc.? But just like you too, none of them said, where are the people? See, the work that we do is about people. Design doesn't matter if it isn't designed for people. And most importantly, as we're doing these designs, we must design with the people that are occupying that space currently in mind. Because too often, engineers and planners do before and after renderings that exclude these people from the future. And then you wonder why they're pushing back against your bicycle lane. See, transportation and planning for too long has been weaponized as a tool of oppression within society. It has destroyed many thriving Black and brown and low-income communities across America, from Louisiana to the Los Angeles to the Charlotte, North Carolinas. You choose a city, you'll find a place where a thriving Black community or brown community was destroyed based upon a transportation decision. We also now know very well the connection between transportation and the climate crises. I was fortunate and unfortunate to have witnessed two of them, two of the most dangerous hurricanes in American history, one being Hurricane Katrina that took place in Mississippi, and then Hurricane Sandy that took place in New Jersey. See, it doesn't stop there though. This connection with transportation is also very vivid in terms of the traffic violence that's experienced on our street. The violence, though, is disproportionate towards older adults, people of color, and people walking in low-income communities. When we take a look at older adults, what we find is that those aged 50 and above, their relative pedestrian danger index is more than a third higher than the general population. When we look at people of color, they're 72% more likely to have been struck and killed by drivers while walking. And then lastly, this is where the empathy comes in at, and this is where it's important for you to see yourselves. People living in neighborhoods with a median household income of $36,000 or less were killed at a much higher rate. I'm here to tell you that low income in California is much higher than 36,000. And so you have to take into consideration that you may find yourself, if not your family members, friends, and colleagues, traversing through these neighborhoods. And if you're walking, you just might happen to be a victim in those very neighborhoods. So at a minimum, empathy should be created. And no, it's not behavioral. It's not anything about these people that lead them to be disproportionate victims of traffic violence. It's not the choices we make, as a DOT professional once said in another state in this country. See, when you look at it from the standpoint of an individual, you think all outcomes are risk based, that if one is smoking, it's going to lead to disease and injury or to mortality. It might. If one has low physical activity, it's going to lead to disease and injury and mortality. It might. If one crosses the street without crossing at a crosswalk, it's going to lead to disease and injury and mortality. It might. All of that is true. However, the problem is your framework. You have to take into consideration that a risk behavior may be caused by the living conditions. And most importantly, these living conditions are caused by institutional and social inequities, which have a bidirectional relationship with each other. So the way this works is that because there are social and institutional inequities, we have living conditions that disproportionately benefit some and burden others. And thus people are responding to their environment. And so if someone comes to you and say, the environment made me do it, they may have a point. See, we live in racial, residential, segregated communities, whether it's in Sacramento and other places throughout the US. You may not believe that, but I've brought data to show you because I understand that without data, all I have is an opinion. I didn't come here with an opinion, I came here with the facts. And so what are the facts in terms of racial residential segregation? Well, let's look at Sacramento first. If blue represents where white people live, if green represents where blacks live, purple Hispanic, and our Asian brothers and sisters are represented by the other peach colors and orange colors, what do you see in Sacramento? If you don't see racial residential segregation, perhaps I'll take you elsewhere around the US. What do you see in Detroit? If blue represents where whites live, green represents where blacks, purple Hispanics, what do you see? Let's go to Houston, Texas, one of the largest cities in all of America. What do you see in Houston, Texas? What about Atlanta? Let's go to the nation's capital. What do you see? See, this is not a state of California thing. This is a US thing. And to make that point more poignant, let's go to one of the progressive cities in all of America, New York City. You still find in New York City that we're segregated by race and by ethnicity. And yes, income factors into it. Are there exceptions to this? Most people ask. The answer is yes. Go to Portland. And if you go to Portland or go to Oregon, if blue represents where white people live, what do you see in Oregon? You don't see much of me. And that is by design. And that has implications that we must address in transportation and mobility. Why? Because race determines place, which determines health. And if we want healthier people, we have to pay attention to the role that race plays in this. And California, unfortunately, is one of the most dangerous states for pedestrians in the nation. You're ranked number 16. That is not good. Close to 1 is bad. 16 is closer to 1 than 50. That is not good. And see, unfortunately, history doesn't say goodbye. Many of you look at what I've said and say, well, that's historical. History will say goodbye. It doesn't. History says, see you later. And what's the later? Right now, many programs, policies, etc., across the country are vowing to ensure that they increase the physical activity and mobility and safety of Black and brown and low-income people in this country. There are a plethora of federal, state, and local initiatives, plans, and programs aimed at this, from Vision Zero to Complete Streets to Open Streets to Safe Streets, you name it, they're out there. Unfortunately, I don't believe, given their current approach, they're going to lead to healthy Americans or safer Americans. And why is this? Because too many of our efforts, unfortunately, are indeed ahistorical and apolitical. And what is meant by that is that the current descriptions of these programs sort of lack any sort of tangible connection and reality of the history of systemic and institutional racism within America. They also fail to highlight the role of state and municipal law enforcement in discouraging and denying physical activity among Black, Indigenous people of color. Thirdly, equity and inclusive access is always mentioned as buzzwords, but unfortunately, they do not tie explicitly to any goal or resources being spent in and with the communities of which they have identified. If you truly believe in this equity work, put your money where your mouth is. Next, there's an unconscious bias in criminalization of Blackness and brownness and otherness that is not talked about in the transportation sector. But when you disaggregate the data, what you see are these are the various groups that are disproportionately killed, assaulted, and harassed on our roadways. And then lastly, there's a lot of talk about diversity, equity, and inclusion, but it happens internally and too often does not impact your partners in a way that is beneficial for all. See, these are not, as many in the health field will say, social determinants of health. Everything I've shown you thus far has been a political decision. Thus, these are political determinants of health. And I'm here to tell you that because of this, you may or may not be aware that as Black, Indigenous people of color in America, our mobility has been arrested. How has our mobility been arrested? Well, I'll use Boyle Heights in LA to give you an example, the land of freeways. Going back to those maps, here's a map of LA. First and foremost, you notice that again, it is racially segregated. Racially segregated. And when you look at the city, unfortunately, in this neighborhood, Boyle Heights, what you see is that it is locked in or surrounded by freeways. Their mobility has been arrested. And so what is arrested mobility, you might ask? Well, arrested mobility is this assertion that Black, Indigenous people of color have been historically and presently denied by both legal and illegal authority the inalienable right to move, to be moved, or to simply exist in public space. This results, unfortunately, in adverse social, political, economic, and health effects that are widespread and intergenerational, but they are preventable. And so, how does arrested mobility then manifest itself? Well, quite honestly, arrested mobility is a direct manifestation across four realms of racism: personal, interpersonal, institutional, and cultural. And this leads, unfortunately, to over-policing, which happens three ways: through policy, through self-deputization of white citizens, and through law enforcement. And this is most evident across the various travel modes in which I'll show evidence of here today. And this then leads to these outcomes that are adverse, and then unfortunately, the mortality that we saw up previously. So how are Black, Indigenous people of color being over-policed? To quickly share some data with you, I'll point to the ways in which Black people are being over-policed in the state of California as well as across the nation. And I'm choosing to share this with you in a more comprehensive way because I don't want this to seem so episodic in nature. I want you to understand that this is a theme, this is thematic, this happens throughout, and we have to solve for it. And so going back to the ways in which people's mobility has been arrested, what you see here is that one is around policy. That is the first way people have been arrested. Whether we're talking land use, zoning, even disinvestment in the infrastructure, we're able to see how people are arrested. The second way is your traditional forms of law enforcement, whether at the state, county, or local level. And then a rising thing that we're seeing, but is not new whatsoever if you know history, is the self-deputization of white citizens in America. Those who, because of the connection they've had historically to both the powers that we deem law enforcement and the powers of planning and decision making, are using this power to indirectly and sometimes directly arrest the mobility of Black and Brown people in this country. And so this happens, unfortunately, whether one is 3 years old riding their bike in their community or walking in a protest on their father's neck. The question then becomes, because that's such a bold statement, is there evidence to support arrested mobility across these various or different modes of transportation? Well, let's start first with walking. In the case of walking, there are three notable crimes or activities that took place in the nation that people remember most. One being Ahmaud Arbery, who was killed while jogging, Trayvon Martin, who was walking, Mike Brown, who was also walking. In the case of Trayvon and Ahmaud, they were both killed by self-deputized citizens. Mike Brown was killed by law enforcement. And so when we look at the data, because again, it's important to show the data, what does the data say? Is this episodic or is this thematic? What we find is that 55% of the tickets in Jacksonville, Florida, were issued to Black individuals, even though only 29% of the total population identified as Black. See, Blacks in that city in particular were 3 times more likely to receive a ticket than their white counterparts. And the residents in the city's 3 poorest zip codes were about 6 times as likely to receive a pedestrian citation. Unfortunately, Raquel Nelson, she lost her son in a hit and run while crossing the street from her apartment. And she was charged with a very serious crime. What they later determined is that the man who killed her son, he admitted to driving and taking painkillers on the night that that happened. But it doesn't stop with walking. I wish it did. It also goes into bicycling. And there are many notable studies from Chicago to Tampa to Oakland that show the ways in which Black and Brown people are being over-policed or policed disproportionately. But what does the data say? Well, in the case of bicycling, between 2003 and 2015, Tampa police issued over 10,000 bicycle tickets. Of those 10,000 bicycle tickets, 79% of those were issued to Black. Nearly 100 of those tickets were issued to minors, some as young as 3 years old. In Oakland, in California, 60% of all bicycle stops included Black citizens, even though they make up way less than 60% of the population. And in Chicago, there were 2 cases in which twice as many bicycle citations were written in majority Black neighborhoods than white neighborhoods, and 321 tickets were issued in a low-income majority Black community there, whereas only 5 were issued in a wealthy majority white community. Why is that important? Because if you know anything about biking in Chicago, you're more likely to see one of our white brothers and sisters bicycling than you are someone of color. So why are they stopped disproportionately more? I wish, though, arrested mobility ended there, but it does not. It also goes goes with public transit. And we know the case of our brother Oscar Grant, who was killed by BART police officers in Oakland. But what does the data say? Well, when you come to New York, they found in a study that while the number of turnstile arrests have decreased significantly, what has not changed is who gets arrested. See, 89% of those arrested are Black or Hispanic, virtually the same since 2014. And of course, the top 10 neighborhoods that had the highest number of arrests per subway swipe were all predominantly Black or Hispanic. And in the case of Adrian Napier, who was a Black teenager, he was tackled and aimed at by 10 police officers for fare evasion. That fare was only $2.75. And so going back to Oregon, in Portland in particular, what they found there was that Blacks were 8 times more likely than whites to be charged for certain transit violations. Thankfully, that was later decriminalized. I make this point because we need to decriminalize it across the country. In the case of arrested mobility, I wish, though, it ended there. Unfortunately, it does not. It also goes into driving, where we have Philando Castile and Sandra Bland, who were both later killed. Some killed, yes, who were later killed. In the case of driving, the stats show that Blacks and Hispanic drivers are stopped disproportionately to white drivers. And unsurprisingly, police are less likely to pull over Black drivers out the dust when the race of the driver is less obvious to police. And in the case of Minneapolis or Minnesota, what we find is that Blacks and Latinos were 7 times more likely to be stopped by police in white majority neighborhoods. But in 2016, 47% of the arrests by the St. Anthony Police Department were of Black individuals, even though the patrolled area is only about 7% Black. Now, does arrested mobility stop there? Of course, it does not. It also extends to ride sharing, where we found that Blacks waited on an average of 20% longer than whites to get a ride, and female travelers were driven about 5% further than males, given the same start and finish. But in the case of arrested mobility, I wish it ended there. Unfortunately, it does not, as we know in the case of Breonna Taylor and Tamir Rice. So then the question becomes, given the complexity around transportation, mobility, and safety and enforcement, how can we then create a safe, equitable, and inclusive system for all? Well, I'll walk you through a justice framework that will assist you in making sure that you do so. It will touch on distributive justice, procedural justice, interactional justice, representational justice, and care. So starting with distributive justice, and this is a framework that you all should consider, the first question one must ask when they're deciding to do something is, who has physical access to that street, to that park, or to that trail? And not only who from a racial, ethnic, income, age, ability, sexual orientation standpoint, but also the various modalities. Is it just for cars? Is it just for bikes? Is it just for pedestrians? Of course, context matters. The point being that if you design something that is exclusive, you must justify why. And this becomes important because my research has shown that many children, many of their families, in low-income communities, do not feel that their children are safe from traffic when bicycling in their neighborhoods. So yes, it's important to talk about safe routes to school, but if mama isn't happy, no one is happy. It's also important to look at the fact that less than 1 in 4 feel that they can safely bike to local parks from their homes. This shows that proximity is not access. Proximity is not access. So it's not just enough to build it. We must provide safe connections to it. Then we must talk about or discuss procedural justice and ask ourselves the question, who has influence over the design, the operations, and programming? We know far too often when it comes to transportation decision-making at the state, federal, and local and county level, that minorities are not included to the degree that they should. This is especially true for minority youth, who are usually not included in planning and transportation decision-making processes. This is a failure on our part because these very individuals stand a chance of being the various ones who are killed in these traffic-related crashes. Then we must talk about interactional justice. What makes people feel welcomed or unwanted in a space? Given our current climate, this is increasingly important because African Americans are 2 times more likely to be killed by law enforcement, and males reported being stopped at a rate 7 times that of females. So it's not just enough to build a complete street if Black males, brown males, low-income males are targeted and cannot enjoy it. Then it's important to take a look at representational justice and ask ourselves the question, do people feel their experience and their history is represented in the space? As transportation professionals, we often hear, if we build it, will it gentrify? In many cases, the answer is yes. Knowing this, we should proactively protect against cultural erasure in communities across this country. And then lastly, care is important as well. See, it's not just though the caring for the space. This again is about centering and prioritizing the needs of people. And so in doing so, we must make sure that we fight against the fact that women have been biased, that transportation and planning have been biased against women and have not done the best it could do in terms of protecting our religious minority groups. And so now that you've had a framework, it's important to use that framework to assess your projects, your plans, et cetera. But it's also important that from the inside or internally, you do a series of things, starting with the importance of changing the culture and the values in these organizations to ensure that this work is the outcome. That must include establishing or undergoing a racial equity action plan process, which includes equity-based trainings, equity performance measures, an internal equity working group, and most importantly, an external equity advisory group. Those are the things that we need to happen that on a state level, a county level, and a municipal level in order to see the equitable and inclusive outcomes that we're seeking, excuse me. And then that brings me to Caltrans equity statement. I was really happy to see California Department of Transportation, Caltrans, release its equity statement, which I thought was beautifully written. I really enjoyed this statement of commitment and number one, prioritizing people. That showed that you have the leadership in place to be transformative across this country. We know how many people are watching Caltrans. I have faith that Caltrans can do what it needs to do from an equity and justice standpoint and be a model for other state DOTs across the country. So I know it's there. But as you move internally, now it's a matter of the decisions you made to make to center equity. And I'll touch on really quickly here, everything from racial equity to common sense, to give you action items that you can do to change things starting today. And the first thing that you can do goes back to the racial equity action plan. Does Caltrans have an amazing equity statement? Yes. But it's important now that racial equity be centered there so that that statement is not ahistorical and it is not apolitical, and that it shows then a commitment to equity through the adoption of a racial equity action plan. Number two, we need a reparation style infrastructure package in Black, Brown, and low-income communities across the state of California. They're disproportionately being killed on the highways, suffering from the health and environmental impacts. So it's time to prioritize investments and maintenance in these communities. Again, it's not enough to build it. You must maintain it as well. Then we must continue to do as environmental justice, Title VI, and other things have demanded of us. We must ensure the full and fair participation of these racialized minority groups. Get them involved early, give them the power to help make decisions and to help guide Caltrans in a way that's beneficial to all. And while doing this, let's make sure that we ensure language equity and access and literacy is prioritized by fostering more equitable treatment of diverse languages in the public sphere. And let's not forget about our elderly and persons with disabilities. So we must work with them to document and increase their mobility and access. And when we work with persons with disabilities, let's not limit that to those with just physical disabilities. We must also seek out the needs and concerns of those with cognitive disabilities as well. And going back to my other statement about how we've been biased against women in our systems and our planning, et cetera, we must meet with them too to understand their behavior and usage differences, as well as our foreign-born populations. And all of this is important because too often the conversation comes up around gentrification and displacement. And again, it is real, it is a concern, So we must proactively evaluate and mitigate against these unintended consequences of improved mobility and access. But I asked a question, if it continues to happen over and over and over again, is it unintended? That's a question for you to answer. Because as we know, trees planted in minority communities mature just in time for gentrification to take place. We must then too work with our local officials and others to analyze the impact of past and current zoning and land use decisions, because many of them have been racialized in nature. I've shown you the evidence via the maps. And then lastly, we must safeguard against discriminatory enforcement. It is not enough to build it. We must work with our brothers and sisters in law enforcement to ensure that everyone has access to the things that we build. And we must do this because in this time, what is needed more than anything is love. So never forget that justice is what love looks like in public. It has been my pleasure speaking to you today about the importance of centering equity to ensure that we have a safe, healthy, and inclusive system for all. Again, happy Black History Month. Thank you to Caltrans for having me here, and I look forward to the Q&A section. Thank you.
Thank you so much. That was fantastic, Charles. I really appreciate that. I had a whole list of questions to kind of jump into, but I really just want to kind of ask some things that came up for me during your conversation. And, you know, I think one of the biggest things, first and foremost, this is a celebration about Black people and the folks that we are trying to make sure that we are intentionally inclusive within our department. And so that I want to make sure that we say that. You've said that over and over again throughout your presentation. Black History Month is February, but we mean this all year long. The other thing, just a quick comment, my past life, oftentimes I'd be sitting in a meeting and somebody would insist on telling me that we'd be talking about equity, particularly racial equity. And it was always well, they didn't mean to. They didn't mean to. I didn't mean to. You didn't mean to. And my comment really at the end of the day was, it doesn't matter anymore. The intentionality has to be there. We cannot afford to say we didn't mean to do something. We need to mean to do something, and we need to be intentional about that. So thank you for raising that throughout your conversation. I really appreciate that as well. In describing and kind of talking about the gentrification, one of the things, if we're doing things differently and talking about intentionality, what do you see are some things as a state department such as ours, what can we do intentionally to avoid that cultural erasure? Or what are some things that we can be thinking about that would kind of support that process?
Yeah, well, first and foremost, I think it goes back to really honoring and centering the voices of these under-resourced communities, underserved communities. They've been speaking about the issue of transportation and gentrification for some time, and yet transportation has said, unfortunately, that gentrification is a housing issue. It's not a transportation issue. We know very acutely the connection between housing or land use and transportation. Thus, there should be no conversation happening on a state level about housing without a transportation professional present. And in the same sense, there should be no conversations about transportation without a housing professional present. See, we live in a very intersectional world. Unfortunately, our jobs have siloed us, and thus we focus just on what's in front of us as opposed to the magnitude and the complexity around the issues that people are dealing with. And so I think it starts with effective outreach and engagement, being proactive on our land use decisions and transportation decisions. And then lastly, it varies in terms of which stage of gentrification you're in. If you're in a place where you find yourself, and there are just a few of these places left in California, but if you find yourself in a place where gentrification hasn't quite happened yet, it's important to start coalition building right now to prep yourself for it so that you can establish community land trusts. You can advocate for inclusionary zoning. You can even look at this opportunity for limited equity co-op housing and community benefit agreements. If you find yourself mid-stage, you can strengthen rental protection, look at tax abatement policies, et cetera. And then lastly, which is where a lot of Californians, unfortunately, especially in big cities, find themselves, they're in late stage gentrification, but it's not too late. You can ask for now employer assisted housing, the establishment of better affordable housing trust funds, and simply dealing with this idea of NIMBYism, which is not in my backyard. So it's never too late, but transportation and health must work together to solve this problem.
Thank you. Rihanna, I would
I meant
invite you to.
transportation and housing and health must work
Yeah.
together to solve that problem. Yes.
Absolutely. I would invite Rihanna to engage and ask questions as you feel.
Is that the
Yeah.
Rihanna? Is that?
Here she is. This is my side gig.
Awesome.
Thank you, Charles. This is, I think, like the third or fourth time that I've seen your presentation, and every time I'm blown away. Every time I'm fighting tears. Every time I'm both devastated and inspired by you, by your work, by the history, by the hope and the challenges and the opportunities, and just the the fact that you're here talking is growth for us, and I just want to highlight you and appreciate you. That being said, I do have a couple of questions. I think that as a department of our size and looking at moving forward and starting this kind of acknowledgement and healing process, our equity statement, the first half was an acknowledgement, and then there was the second half was the commitment. And I'm curious about how you think a department like ours starts to move towards healthy relationships with communities. And I think that we in the past have but quite clearly not done justice to our communities throughout the state. And it's time for us to start looking at moving forward. And I'm curious to hear your perspective on how Caltrans can really start the healing process, and kind of the foundational aspects of healthy relationships with government and community.
Yeah, that's an excellent question. I want to start by saying that I believe that if there's any DOT in the country that can do it, it would be Caltrans. I want to start there. But when we talk about this idea of healthy relationships with communities, we have to consider, why are they unhealthy? They are unhealthy because of harmful transportation decisions that have been made that have disproportionately impacted Black, Brown, and low-income people in California. And I showed the case of like Boyle Heights and others, where these transportation decisions, intended or not, have destroyed the lives and health of many people. There's also been a lot of failure and unfulfilled promises, I'm sure, that have been made to many of these communities. And then lastly, there's been years of disinvestment that has happened. And so the way that you repair a relationship is that you don't continue to disinvest, you invest. You don't continue to make harmful decisions. You make decisions that are safe, healthy, and lead to better outcomes for those people. And then lastly, you don't make promises that you can't keep, but you live up to those promises, and you recognize that these communities, again, whether intentionally or not, have suffered disproportionate harm. it's now time for them to receive a disproportionate share of the budget. And in this particular case, a disproportionate share is a much, much larger share. And so going back to what I stated, the three principles of equity, this is about a distribution now of resources to ensure that you can make up, hopefully, for much of the harm that has been done. And so if you can now invest in these communities, I think you can begin to repair the trust with them. I think that'll go a long ways.
Thank you.
Thank you. Charles, what are your thoughts about when folks, particularly well-intentioned folks, have this sentiment around working on inequities or equity generally, and not focus solely on race or start with race, but really all the protected classes? What are your thoughts, and what do you say to those folks?
I don't. But if I have to, I think it's important to address the sort of selective ignorance that one has chosen. Because if you're at a position now where you don't see the importance of race and equity in transportation and housing, pick a sector. If you don't see the importance of it, I think that's selective ignorance. And I think that's extremely dangerous because it's harmful to all the people who are suffering disproportionately. See, there's a mountain of data out there. These well-intentioned people are simply choosing to ignore it. And the time is up for that. We have to do what is right. We have a moral and professional obligation to do what is right. And we love to say in our sector how evidence-based we are. Well, the evidence shows that Black, brown, and low-income people are suffering disproportionately due to our decisions. Again, it's now time to invest to make up for the past wrong that was done. So for those people who choose to stay over there and talk about other matters without centering race, I choose not to give that selective ignorance any attention because I think it's harmful and dangerous.
Thank you.
Wow. So when you put up the slide about transit, I thought about last year I was in New York and I remember I got off the subway one time and there were like 16 officers standing there. And as a girl from California, like I was like taken aback. I was really shocked and I was highly uncomfortable. I was like, I got to get out of here. And so I segue that to say, when I look at pictures of like Ahmaud Arbery and I think about, this push for people to do things like use transit, this push for people to do things like get outside on a bike, get outside on the sidewalk and run and do. And the reality is, for some people, we don't feel safe. And you can build all the infrastructure you want, but we're still not safe. And so, my question to you is really, how do we as transportation, we have staff who are saying like, I build it. My job is to do the calculations. My job is to make sure that the sidewalk is, X wide by X high, things like that. And so my question to you is like, how do we push for this deeper level of analysis, this deeper level of understanding, and these really broader conversations that go deeper than the measurements and deeper than um the like I don't like the perceived reality,
Right,
the design.
right. I think it has a lot to do with, we started the conversation with me identifying first as a street level researcher. That was very intentional. And that was intentional because I think the answers to our problems are found in the street among the people who are having to navigate the challenges in which we're talking about. And unfortunately, as you know, like I know, the concerns and the needs of those people too often don't make their way to the decision makers or the powers that be. Another side of this and an issue is that many of our brothers and sisters who are engineers, who are planners, are not as sociable as they could be. They're very reserved. And so they prefer to deal with the black and white, the numbers, as opposed to going and interacting with the people. That's why we see a sort of hierarchy that favors quantitative approaches to qualitative approaches. See, we as Black and Brown people, we believe in the richness of conversation. Now it's up to you to go quantify it, but we believe in the richness of stories, remembering the importance of what happened. And so the disconnect is that our systems are designed by people who don't value remembering, who don't value the richness of those stories, and who quite honestly don't have the makeup to process it in a way that is meaningful and in a way that changes the way in which we make decisions. So what am I saying? We need to diversify the staff internally to better reflect the communities in which we're trying to serve. That will go a long ways. And we need to document our own internal history to show them evidence of the decisions we've made which have led to disproportionate impact on people so that they don't think this is a conspiracy. They understand that this indeed is factual. And going back to my earlier comment, if that doesn't work, don't spend your time with those people. Focus on the people who are truly about helping all of humanity, not those who choose the side of selective ignorance. At least that's how I spend my day. That's why I'm here with you all. You're willing to listen.
Thank you for that. I think that is a fantastic way to end this conversation today, bringing in, kind of the impact and the emotional aspect of this day in and day out conversation. So I really, again, thank you. We thank everyone for joining us today. Thank you, Rihanna, for joining. This is a fantastic conversation. Hope to have many more with you, Charles. Yesterday, I enjoyed our conversation and today as well. So again, really mad props, appreciation, and everybody else out there, thank you for joining in.
I like how you
Thank
dropped
you,
that mad
Charles.
props. I love that. Mad props. Mad props to you too for inviting me. It was a pleasure to be here. You all are family out west. Please stay in touch, okay?
Thank you.
Take care. Bye-bye.
Bye.